Stress urinary incontinence, sometimes abbreviated SUI, is the loss of urine with physical activity or exertion, such as coughing, straining, bearing down, laughing, or jumping. Stress urinary incontinence in men is most commonly caused by treatments for prostate cancer, such as a radical prostatectomy. This can lead to deficiency in the sphincter mechanism, and which leads to loss of urine with that physical activity after prostate removal. Stress urinary incontinence in the male can be diagnosed by your urologist with a careful history and physical examination. Patients will oftentimes report loss of urine with physical activity, which is the definition of SUI. We oftentimes perform a cough test with a full bladder to demonstrate that leakage on exam. It is important to see a urologist that specializes in stress urinary incontinence, as not all urologists treat male SUI, and treatments are very specialized. There are a couple of excellent treatment options for male stress urinary incontinence. For mild cases involving 1 to 3 pads per day of leakage, a great option is the male sling, which provides pressure on the urethra to relocate that urethra and support the sphincteric mechanism to get that man dry. For more severe cases of leakage, greater than 3 pads per day, especially after a radical prostatectomy, the best option for those men would be an artificial urinary sphincter. This allows a balloon to be placed around the urethra to close off the urethra at all times to keep that man dry in between voiding. The treatment options for male stress urinary incontinence are driven largely by the patient history. If it's very mild leakage, only 2 or 3 pads per day, those patients are going to be best served with the male sling. I can do a little small procedure in the office called a cystoscopy, in which case we can look at the external urinary sphincter under direct vision and ensure that sphincter is still able to coapt and is still functioning. If the external sphincter is still functioning, there's a very good chance that that man will achieve complete dryness with the male sling. For heavier cases of leakage, those men are better served with an artificial urinary sphincter. Cystoscopy is generally still performed in the office to rule out any scar tissue or bladder pathology and evaluate bladder capacity prior to proceeding with an artificial urinary sphincter. If left untreated, male stress urinary incontinence can lead to skin irritation and continued pad usage, as well as negative quality of life side effects associated with constantly being wet.